Experts are worried about the possible surge in cases in Metro Detroit this weekend, and that's our topic in tonight's 7 Up Front segment. On Saturday, the Wolverines take on the Spartans at the Big House. Although only family members of players can attend the big game, there are fears of gatherings and parties where people could get infected. Joining us tonight, Dr. Rudolf Valentino, who is the Chief Medical Officer at the Detroit Medical Center. Doctor, thanks for being with us tonight.
Oh, thank you for having me.
Let's begin with that Saturday football game, Michigan State and Michigan. Stadium, as I mentioned, will be mostly empty, but you got to believe parties and tailgate events will likely take place still. So what would you tell people about being diligent to stop the spread of the virus?
Yeah, the COVID-19 virus is clearly a deadly actor, and we have to respect it. The best way you can protect yourself really is that 6 feet of distance, wear a mask, and really try to, if you need to celebrate in very small groups and ideally in your own little bubble. I mean, I really don't think those gatherings are healthy. I think the new term is super spreader. And when you get into these, especially indoor events, as was just discussed, the indoor events are more troubling than the outdoor events. But even the outdoor events, it's very common to, when you're around friends, to want to give them a high five, or you have to keep yourself safe. So truthfully, avoidance is not a bad way to go. I know the fans will be excited, but watch the game in your house and talk to friends on the phone, FaceTime, whatever you have to do. But I really think the more gatherings we have, the more we're inviting trouble. And I think Dr. Khaldun just told us how the caseloads are going up. It's going to put strain on our hospital systems, and we're going to see more bad outcomes, unfortunately.
To that end, also Saturday, Halloween, of course. So what is your advice to trick-or-treaters and parents this year? Proceed very cautiously, I'm sure.
No question about it. I mean, I think Halloween is a very fun holiday for kids especially, and I think most of us parents all enjoy watching the kids come to our door. I think a lot of communities are really toning it very down. They may do something in their backyard for a small group of people because you're really trying to control the traffic. You're really trying to control the situation. I think this just might need to be a year where we celebrate again as family as opposed to mingling in neighborhoods. I think every time you go to another door, you bring your germs with you, and you're either going to share what you have or pick something up. So I think laying low on Halloween is still not a bad thing to do. You can dress up, you can celebrate as family. That's my best recommendation.
And we've got an election just 5 days away now. It's the first during a pandemic. What should people watch out for? What extra precautions should they take if they plan to go to vote in person this time?
So if you're going to go to vote in person, be cautious to give that person in front of you or behind you 6 feet. Wear your mask. Hand sanitizer hopefully is everywhere around the voting booth situation. So we make sure that that if you use a pen to cast your ballot, that you sanitize before and after touching it. It's that usual, the things that we've been talking about really since March, they really do work. I think when we keep that distance, when we wear a mask, we sanitize our hands, we don't shake hands, we have to use those somewhat antisocial behaviors because this is what we have to do to get through this year.
All right, it's flu season now, and as COVID cases rise again, you mentioned it earlier, increased hospitalizations, more deaths sadly will follow. Are hospitals in Metro Detroit prepared to take on this second wave of COVID-19 cases?
We're absolutely prepared. We're here to serve our community. Fortunately, for the moment, southeastern Michigan has not been hit terribly hard, but we do see trends in some of our neighboring hospitals where the caseloads are starting to go up. So we as a community have to do what we can to control the spread of the virus, to get our flu vaccine, because if we can prevent, remember, flu can put 500,000 Americans in the hospital every year. And we can have, last year, I think the CDC had about 34,000 deaths from influenza. So those are in large part preventable with a flu vaccine. So there's no reason to put strain on our healthcare system by adding flu to a situation where the COVID is something we have a hard time controlling. We don't have a vaccine for COVID. We have one for influenza. the responsible action is to get that influenza vaccine as long as there's not a contraindication, which in most cases there is not.
Great information. Dr. Valentini, we appreciate your time. Hope you'll come back and share more with us in the weeks and months ahead.
Would love to do that. Thank you so much, Dave.
Thank you. Dr. Rudolf Valentini from the Detroit Medical Center.